We're thinking about creating delivery of your drugs straight home to you once we have adequate means of measuring it and ensure that it gets to you and it doesn't create any form of stigma and there's the loss of those medications.
That was Tariq Jagnarine during a recent interview with Nightly News. Over the years, Guyana has made tremendous strides in its fight to eliminate the prevalence of HIV. In 2020, the country surpassed its testing target, with 94% of the people living with HIV diagnosed in 2019, with 73 of those persons on treatment, a significant achievement for NAPS. More so, 87% of these persons on treatment have obtained viral suppression, but the emergence of the COVID-19 pandemic in March 2020 birthed new challenges in the country's fight against HIV. According to Jagnarine, a number of persons have not been accessing their treatment due to the fear of COVID-19 exposure, and in this regard, NAPS is strongly considering to put systems in place that will facilitate home delivery of the medications to persons infected with HIV. This alternative will greatly assist in combating the challenge posed as a result of the COVID-19 situation. It was, however, noted that home delivery of the medication would not be possible to every person living with HIV. At present, there are over 8,000 persons living with HIV locally, and there will certainly be some logistical challenges for the entire HIV population in Guyana to gain access to this service.
Maybe those who are disabled, those who can't access service at the health center, those who face serious stigma and discrimination. So it would be on a needs basis. We evaluate it and then we try to tailor to that approach.
Meanwhile, the organization has also expanded its PrEP and NPrEP campaign.
We have expanded that services to 16 sites, including sites in Region 3, 4, 5, and 6. Sites such as the West Demerara Hospital, the Grove Health Center, the Diamond Diagnostic Center.
In January, the local Minister of Health, Dr. Frank Anthony, made the announcement that Guyana will roll out a comprehensive plan for pre-exposure prophylaxis, PrEP. Since 2015, the World Health Organization has recommended that people with a substantial risk of HIV infection should be offered PrEP. Pre-exposure prophylaxis, or PrEP, is a medicine for people at risk with contracting HIV to take to prevent them getting HIV from sex or by injection through drug use. When taken as prescribed, PrEP is highly effective at preventing HIV. Several countries have prioritized key populations including gay men, sex workers, and transgender people as candidates for PrEP programming. In Guyana, those groups also have higher HIV prevalence, 8% for transgender women, 6% for sex workers, and 5% for gay men. World AIDS Day will be observed on December 1, 2021 under the theme Ending the HIV Epidemic, Equitable Access, Everyone's Voice. To this end, a number of activities are slated to be hosted by NAPS, including competitions for art and poetry in conjunction with community outreaches. For the HTP Nightly News, Kendell Richmond.